Hello everyone and welcome to our 81st AeHIN hour. We are now using GoToWebinar. If you need assistance, please feel free to send us a message through the chat box so we can help you. If you're having difficulties in configuring your connection, please log out for the session and rejoin again. You may also use your smartphones or tablets to join by using the webinar ID 515-587-811. For attendees, your microphones are muted throughout the meeting. You can chat your thoughts to us through the chat tab, and for questions, please type them in the Q&A tab. All questions will be answered after the speaker's lecture. Tonight's speaker is Dr. Suresh GP, who is the regional leader of CCNC Solutions for Southeast Asia region. He has over 16 years of experience in IT service management, IT governance, project and project management, program management, Agile and DevOps practices. He is also a renowned international speaker and blogger and delivers trainings across the entire Asia-Pacific region. His certifications include the following. Without further ado, may we now call on our speaker, Dr. Suresh.
Thanks, Shah. Good afternoon, good evening, everyone. So let me just give me a second as I just pull in my presentation. Just let me know once you see the presentation. Sorry, I think. Okay, so sorry about that. Okay, so let me know once you see my screen.
I can see it now, Dr. Suresh. Thank you.
Thank you. So first of all, thank you guys for joining me here for this edition of AeHIN webinar. Thanks to AeHIN for giving us an opportunity to share some insights and knowledge about the latest trends in that is impacting the health sector. I'm so glad to be here. I had a great opportunity to be in Myanmar, talking about meeting a lot of you people there. So it's a great privilege to be here to present this webinar. Now, this is going to be a 1-hour webinar, and as like anything, we would do a 45 minutes of presentation, basically with some scenarios and case studies as to how we are seeing digital transformation impacting health sector. So I would strongly encourage you to post your questions on the question window, and we will take it after the end of the presentation. So feel free to shoot out your questions. So we'll be more than happy to share insights and clarify your questions. So thanks for the kind introduction. So my name is Suresh GP. I represent CCNC Solutions for Southeast Asia, and we'll get things started. So when I talk about digital transformation, let me just ask you a question. What is, in your opinion, called digital health? When I say digital health, it means so much different things. So if you look at the graphic, it could mean that we are actually talking about patient reports available digitally, booking appointments like Practo and other channels digitally, measuring your parameters, vital parameters digitally, also looking at the entire logistics, healthcare, and even accessing your drugs using smartphones, right? So it means everything right from the time the patient has gotten illness to the time that he gets recovered fully. There's a lot of aspects attributed to digital health. And to make this work, you need to have a robust infrastructure, and not only the infrastructure, people, process, products, and partners that will actually make this a viable solution. Now, we all know that digital transformation is getting big time because of the advance to cloud, mobility, social, and also automation. So what we're going to discuss today is how is this digital transformation going to impact health sector, and what is it needed really to step up to make this a viable solution. So we know we have a lot of government rules and regulations, a compliance aspect, data security, privacy. So we'll see how these elements actually encompass the digital health aspect. So as I said earlier, if you have any specific questions, please put into the question window. We will take it at the end of the presentation. So if you ask someone, what's the problem of the healthcare? And this is from Global Healthcare Practice Lead, Chris Sullivan. He says the problem is in healthcare isn't a lack of data. It's a lack of coordination and interpretation of that data. Many times we see duplication of data. We see the data not being harnessed properly. Ability to make meaningful representation of the data, like predictive analytics, and giving meaningful representation of the state so that the patient or the doctor or the healthcare systems can derive meaningful value for the consumer, right? So it's been a problem of coordination end to end. So that's something that we need to think about. And in fact, when I was having the discussion in Myanmar, we see a lot of discussions that popped up on data governance. We talked about privacy of data, protection of patient healthcare. So a lot of things are happening, but it's not been aligned properly. And people have to use different credentials to log into the systems, and it's getting completely chaotic, right? So with digital, we hope there has to be a seamless way of integrating all of those data elements, and we are able to get one snapshot of whatever ailment you have taken, one in, let's say, in Singapore, in Malaysia, in Vietnam. You still have to have all the health historic data available to make meaningful diagnosis, right? So if you look at the digital roadmap, if I look at healthcare industry, I would divide it into 3 sections. See, on the left-hand side, you see that you have the customer experience, where we take care of the patient. So number 1 is how to enable people. So we talk about agility and effectiveness, how to enable things to work as it's needed. The second element is called differentiate. How to differentiate with product services. If you're a healthcare company, if you're a pharmaceutical company, if you are an institution offering healthcare, how do you differentiate with your product services and business process? And also look at your business model. How are you going to get revenue? How is your insurance agencies going to work with you in order to make sure that the customer, which is basically the patient, has got a holistic experience in going end to end, right? So on the first layer of customer experience, we need to improve patient experience right from the time he enrolls into a clinic, a hospital, going through the safety of the patient in terms of his drugs, in terms of his prerequisites, and improving the integrated healthcare experience end to end. That falls under the customer experience quadrant. The second quadrant that requires something to be focused is your existing business process. We were talking about what's the difference between a private healthcare and a government healthcare, because the way people experience in terms of enrolling themselves when they get admitted to a clinic, and then they understand your business process is very cumbersome. It becomes very difficult to even get an appointment and do a diagnosis of doing that. So how do we, as a business process within your healthcare unit, be it private or public, improve your operational efficiency and make sure that you utilize your resources appropriately? It could be the ventilators, the respirators, the kind of infrastructure, the medical equipments with kind of sanctity that you need to maintain is utilized appropriately and improve clinical workflows. Now, one of the challenges that you all will agree, every time we do a clinical experience, it differs from one consultant, one practitioner to another practitioner. So some of them does it very well. Some of them do not do it appropriately. So there's a kind of people-centric focus on clinical workflows. So how do you create a repeatable, consistent performance of your clinical execution? That's an important aspect to focus when it comes to business process and operations. The next quadrant is called the workforce productivity. Be it nurses, be it doctors, physicians, surgeons, consultants, we need to know how can we actually make sure that we don't waste a lot of time to go back and forth. How can we get the data quickly, enhance the capabilities to go to across regions, across geographies, and decrease the operating cost, and improve the efficiency. So these are other key elements of drivers that we see as part of workforce productivity that we need to improve. And if we don't do this well, that means the operating expenses for hospitals, private healthcare, and government healthcare is going to proportionately increase, which means the value is not going to be realized, right? Having said these three quadrants, that is the customer experience quadrant, the improving the business process and operations, along with workforce productivity, a very important aspect is risk management. How do you lower the risk of ailment for a patient? How do you lower the risk in which surgeries are performed and it doesn't go to a failure? How do you protect the patient information in terms of health ailments and protection of their identity and data without affecting and impacting people? Those are very important elements that you see as part of drivers. Now, with this said, as part of the healthcare, what is important is you need to have a digital ready foundation. Now, these elements will have to be encompassed end to end. Typically, we call it as a value stream mapping, where every element or activities in that particular chain, we need to look at what are the value-added activities, what are the non-value-added activities, and start improving. So if you are typically looking at a sector, we need to look at your security, which is data center security, where the data is actually hosted. If it's on a cloud, how does cloud is getting enabled? We use a lot of Internet of Things and digitalization that happens along with your sensors. Sensors that predicts your heartbeat, your blood pressure, all of those vital parameters, along with automotive and infrastructure that facilitates the whole stuff. So end to end, you see there are a lot of components that is needed to make this digital ready, viable solutions being provided by healthcare, right? So this gives you a context of how healthcare domains have to be thought over from an enabling perspective, differentiating perspective, and defining business models. Now, if you look at the change drivers and what is impacting today, a lot of these things is just not about experience and expertise. We are looking at how to do predictive analysis. For example, if there is a disease that needs to be addressed. Now, what we need to look at is in terms of what is the geography it is actually affecting, what is the kind of sanitary conditions it's happening, the economic conditions, the drugs that we prescribe, and look at different analytics to really decide on which kind of drug or ailment process will help them to mitigate the whole risk. So there's a lot of demand that is coming with new skill sets of Internet of Things, analytics that we need to do. So there has to be a kind of a consolidated portfolio which is providing that kind of snapshot of what is the analytics which is pertaining to cancer, which is pertaining to HIV, which is pertaining to a kind of a disease like or an infection like SARS. All of those stuff will have to be assessed. And what we're seeing is that there is a lot of automation comes into picture so that we are able to align it across geographies, across centers. Today we are seeing a lot of telemedicine. As you know, telemedicine is actually improving the way we are able to reach to a wider audience. So as long as you have your smartphone and internet, you will be able to exchange conversation with the doctor and get his required prescription to what needs to be done. And we are also seeing a lot of concerns about geopolitical and business risk, where we need to make sure that across geographies, people are able to get the required services without impacting political adverse situations as well. So there's a lot of drivers from a global perspective that we see is driving healthcare initiatives. So some of the drivers which you see from digital transformation, and this is a report from SIC 2016 says is patients are really driving the change to digital. Patients really want to go digital, and that's why the whole economy is driving to digital transformation. 1 in 20 Google searches are for health-related information. 62% of the smartphone owners look up health conditions. So I was actually doing a research yesterday. The kind of things people post is, this is my body mass index, this is my blood sugar level, this is my cholesterol level, what do you prescribe for? So people are kind of increasingly getting conscious of their existing food habits, lifestyle, and say, is this the right way to deal with things? Are we missing something else? So there's a lot of that stuff looking across here, and we have seen some of the aspects which are kind of alarming is 35% of reported data breaches are in healthcare industry. So this drives to the point that we need to protect privacy, data, which is making sure that this is not leaked, and that could have adverse impact in the way things are working. And we also see some things, a lot of wearable devices where people are going to manage the health. Gone are the days where we used to go to a clinic to measure your vital parameters of blood pressure, your blood sugar level, cholesterol, all of this stuff. Now you have mechanisms which can actually, wearable devices that will measure your footprints and say, how are you doing, good, bad, or ugly? You know, that's a much more easy way of predicting your existing threats and taking some relative actions. If you look at 2017, as part of digital transformation healthcare, we are looking at IT is ahead of the business in considering digital transformation in healthcare. But what's happening is providers were ahead of payers. So which means that if I am a service provider of a healthcare, I was ahead of giving people an experience of paying through digital. But now we need to have an omni experience. What it means is, right from the time you get introduced to a healthcare unit, fixing up an appointment, going through the investigation and diagnosis of your healthcare ailment, until the time you get prescription for drugs and you come comfortably with that, the entire experience is have to be an omni-channel experience. So it's expected by 2018, deployments of digital transformation will be 42% for providers and 58% for payers. So we are seeing today a lot of these payments going through payment gateway, cashless transactions, and instruments which you don't require anything. It's all on mobile devices. So you can actually make both the payers and providers get it easy. And even when I say payers, it could also be the insurance agents. How quickly can I get my claims reimbursed? So someone goes through the surgery, he actually scans the bills and receipts, and how quickly the insurance agents can cover up based on what kind of contract he's got it, and then pay back on those stuff. So you see a lot of these transformations happening already in healthcare. Now, if you look at 2020, the kind of evolution, and this is the predictions from the experts, you're going to see a lot of robots. In 2019, there will be about 50% increase in the use of robots to deliver medications, supplies, and food throughout the hospital. Right? So we are seeing drones coming there and delivering those devices. 60% of healthcare applications will collect real-time location data, predictive analytics to discover patterns, and so that you don't need to really have clinicians. So what is going to happen is, based on certain trend of your user pattern, how you're doing your ailments, it is going to tell you, what is the next step to do that. So you don't really require a physician or a consultation from clinicians. All they have is, it's all programmed, and that will be giving us like a FAQ or a kind of a chat, which will give you, okay, based on this data, this is what we prescribe with. So it is like that, right? And you see that personal health data will offer personalized benefits to consumer based on the data, right? And if you look at on the right-hand side, you see there's going to be security issues. Because we're going to be increasingly digital, that means Wi-Fi's are going to be open, hotspots are going to be open, so people are just going to get attack all of those stuff by 2018. So it's going to be increasingly vulnerable to cybersecurity threats, right? Passive to active patient engagement in 2017. So you're going to see a lot of people passive. So they're not going to come here. They're going to be in their own houses in their own locations and getting treatments. So the kind of interface of patients coming here is going to reduce, right? And we're going to use wearables and going to be monitoring all of those stuff. So you see, there's going to be huge transformation that you're going to see as part of digital healthcare. In any digital benefits, we see that it has to have less effort, it has to have more control and greater speed. So when I mean to say less effort, what's the setup time does it take to install your devices and show results in terms of your vital parameters? How do you get more control in terms of the entire dashboard? So it's a single click where we have zero downtime, right? And also, how quickly can I go and look at releasing a drug, releasing a product, releasing some reports on runtime? Gone are the days when people used to go for a health check and say that, your report will be available at the end of the day. Now it has to be instantaneous. So if it's all, once I do my ECG, if I do my X-ray, if I do my thermal test, it has to come instantly. So I know exactly where I am rather than waiting and watching for that. So it has to be at a greater speed because the kind of disease penetration is going to be huge. So I need to take quick decisions, which means the digital transformation has to help us provide that kind of a platform. And that's why we have to kind of work during that particular fashion across, right? Now, there are some challenges when you talk about digital transformation, because digital transformation, as you know, requires a lot of practices to be at a foundation level before we realize maximum value. Now, this is a snapshot of some of the transformation challenges that McKinsey has reported. Each of the following describes different types of challenges surrounding digital transformation initiatives, and it is true for healthcare sector as well. So it could be challenging or very challenging. For example, lack of data or ROI to justify value of digital transformation. So what is the value that we get by moving from a traditional paper set model to a digital transformation completely, right? What are we trying to achieve as part of this particular thing? How is people's behavior changing with digital transformation? People still don't feel it comfortable to enter data through some devices, right? I still know a lot of people say that we don't want to get into this mobile phones and apps. It actually makes our privacy very difficult. So we want to really go in the traditional way to do that. So it's a consumer behavior. How do you actually adopt to that kind of a trend? Risk management. Yeah, there's a lot of compliance rules and regulations coming across from healthcare, HIPAA regulations that you see. How are we kind of driving and making sure that that is protected when you go from a digital transformation? I do consult a lot of healthcare institutions which are very specifically focusing on HIPAA in the US. And they say that, with digital transformation, how do you ensure compliance aspect of it? And that's a critical component of it, right? I mean, it could make your life a lot more easier by doing digital transformation. But what you should understand is it's just not about digital transformation. It's about making sure that you're able to run the systems with adequate protection of intellectual property, assets, copyrights, patient healthcare information, all of those stuff, right? And you see, this one is very interesting, and that's what I want to build upon that. 63% changing company culture to be agile. And that's one of the things we see a lot of handicap there. People are just still following an approach of being traditionally focused. This is what we have been running. We want to run this one. So how do you make the existing healthcare systems, existing medical facilities to move towards an agile way of working, like sprints, running iterations, running improvements, right? So that's something which we see is increasingly coming important from a challenge perspective. So what does it mean to do right? If someone says that I'm doing digital transformation rightly, it means that you increase your ability to provide products and services to customers and partners across multiple channels, right? So be it anything that you want to do it, like telemedicine, ability to go wearable devices, ability to capture every information through digital footprint. How do you do that? By reducing cost, increasing agility, improve customer satisfaction, greater efficiency. We talked about the model of improved workforce productivity, improving the systems and process and all of those stuff. Now, if you're not doing it right, what does it mean? If I say I'm not doing digital transformation wrong, means you're wasted in terms of investment. How much time we wasted in terms of lost opportunity, lost revenue because you're spending so much effort without getting return on investment on that. People are not happy, customers are not satisfied. They say that this services is not helping them. They get very scary about it, and people stop coming to the healthcare. So loss of customers, frustrated. So people, physicians, doctors, nurses lose interest because it's not agile. It's getting bureaucratic processes. So people say, "Oh, I'm wasting a lot of time. I don't want to get into this junction at all." And then they slowly just park their ways out of the system, right? So how do we really make that correct first time right? That's a challenge that we are seeing in the healthcare. How do we ensure that the digital transformation strategy works in the way to address these issues? If you ask anybody about digital transformation, they will typically tell you it's all about SMAC, which is social, which is a social media engagement where you're connected. It could be on LinkedIn, it could be on Facebook, it could be on Instagram. How quickly can you connect with people, right? Mobile, so everything is kind of mobile experience. Today, mobile is becoming a wallet. Mobile is becoming all in all. So everything that you want to do, you just have to have mobile. All data is available. Your transaction that you need to perform in terms of payment gateways, in terms of passing the information to the cloud, everything is actually controlled by mobile. And increasingly, we see analytics being useful for the healthcare industry because we look at the trend in terms of healthcare, in terms of the viability of people staying alive for a longer period of time because of medical improvements, right? Earlier, I remember when we started growing, we was talking about an average age of a person to live in this earth is about 60 years, right? And this has easily come to about 70 to 75. In some countries, it's gone up to about 80. So analytics is telling you trends of how people are happening. But interestingly, you also see this current generation of people. We are losing people left and right, even at age of 30 because of our incompetent lifestyle habits, the way we consume, the way we work, the way we have stress. Everything is actually putting a toll on our health. So analytics is giving you a pictorial representation of what is really working and what's not really working and how we need to make decisions based on that, right? And because of cloud, there's a lot of economies of scale is happening. It's bring down the cost factor completely, and we are able to do everything on the cloud. So you don't need to have physical infrastructure. It could be dynamically provisioned across. So you have Azure, AWS, Google platforms that will give you this facility to scale up in any kind of an environment we talk about, right? So typically, this is kind of an identity when you talk about digital. It has to be social, it has to be mobile, it has to be analytics, and as well as cloud to make meaningful representation of end-to-end. Again, if you look at this one, it's talking about an omnipresent consumer experience. Right from the time you connect with till the time it gets to a completion, the end-to-end model is what we are talking about as part of the SMAC experience. And you all will have experienced something or the other, how things are working, right? So it's very important that if you are into a digital transformation, you should be actively pursuing SMAC to make sure that you are fully leveraging the power of these elements, right? At this moment, I will just take a pause to see if there are any questions, Cha, and we can take it, and then I can proceed on further on this.
Yes, there's one question here, Dr. Suresh. It's from Dr. Eliza. The question is, how can we help old healthcare staff to adapt new technology?
Right, that's a great question. The challenge we have typically is this technologies come just like that. Today there's a technology, tomorrow there's another technology. So one of the things that it's very important to get staff, get ready for technologies to create awareness. Many of the times when we do these workshops, we need to understand the domain, but we need to understand some use case scenarios. So what we try to do from an awareness perspective for your staff is to bring in something that is talking in the language of them, of how this technology is going to help them in a pure non-technical terms. So what I mean to say is that you need to have someone who could explain what is in for me that is going to improve with adopting to new technology, and it is to be easy to adopt to a technology. So there's a lot of training, awareness, and have an expert who understand your health domain and then talk about it should help. For example, we were having a discussion, and we are having a discussion that governance for healthcare professionals is a big topic. And when we are talking about it, you have COVID like a governance framework. But then what happens is it only tells a framework. But what is it in the context of healthcare? So what we are trying to work now is with healthcare professionals and find out what are the common issues with respect to governance in healthcare. And then we relate to the context of what governance means. Like, for example, architecture governance. We can talk about enterprise governance, data governance, and see how that needs to be addressed. So it has to be kind of tailored to the specific needs of your staff so that they don't get overwhelmed. Unfortunately, most of the technology makes you overwhelmed because it's all kind of jargons. So what I would suggest is to come up with, get a practitioner who's got a health domain aspect and also understand technology to come there and give like a 1-hour sessions like this to give them a feeler of what is it. So it doesn't sound scary, and slowly you can make them adopt. So I hope that answers your question. Any other question, Shah?
Thank you, Dr. Suresh. Here's another question. This one is from Dr. Ugyen. It reads, how can we make health personnel, especially the physicians and nurses, to adopt new technology given their heavy workload?
Okay, so how can we make health personnel, especially the physicians and nurses, to adopt the new technology given their heavy workload? Very, very great question again. Thanks for pointing that out. Now, one of the things that is very critical is everybody is busy. I totally agree. Physicians are busy, nurses are busy, but there has to be some kind of talent development and workforce development, skill development as part of the exercise. So what I'm saying is that if there is a nurse or a physician who's working, he has to be only working for 80% of the time. About 10% of the time has to be allocated for learning new skills, technology, adapting to the new market, to the trend. So what I normally recommend people is to have a time or allocate it for a plan for self-development. Because what's going to happen is, if you just keep on doing what you're doing, you will not have time to sharpen your axe. So if you use the same tool and cut your trees, it's not going to work until you sharpen your axe. So it's very important to make sure that your staff or things have got at least a 10% or 15% of time where they can actually go there and adopt themselves to learn this stuff. So it's a discipline, and it is important that you give people the time to recoup with new skills and technology. Hope that gives you time. It's going to be difficult, but we have to start now. Otherwise, it will be too late for us to make that happen. Right? Anything else?
I think there are no questions so far.
Yeah, so we will move ahead, and then we'll take the other questions later then. Yeah. Okay, so now if I want to get this one moving in terms of digital transformation, you're going to actually do a few things. We need to start from the customer, the mission. So who is a customer? It could be a patient, it could be an insurance agent, it could be regulatory authorities. You need to understand who is your customer when you're talking about what part of healthcare segment you're trying to do it. So we need to look at their customer journey and digitize end-to-end. That's a kind of an omni-channel experience that you're talking about. We need to break down the functional silos, right? Because you can have your a team which is got from an insurance team, then there is an admin team, there is a lab team, there's a physician team, there is a support staff team. There's so much teams that are working to make the experience of a customer a holistic one. So we need to look at how to work with these cross-functional teams and make this a clear mandate of going through digital transformation. We need to have measurable targets. What is important for your patient? What is important for the insurance agency? What is important for governance authority? What is important for security professionals? So we need to really look at measurable targets that we need to focus. It's called the ground control. And we need to look at budgets, you know. It's not possible to get into digital transformation without allocating sufficient budget. It would require education, it would require improvement in terms of infrastructure, awareness, doing some workshops. That would require budget, right? And it is an investment, right? So you need to really look at how do we reallocate the investments to make the customer experience a much more profound one. Focus on then talent, right? Which is basically all your, and you all understand, if you need to give a holistic experience of healthcare to the consumer, it all depends on how dedicated and committed staff you have in terms of physicians, nurses, surgeons, consultants. Now you need to make sure that they get something to learn, because learning in this era is phenomenally important, right? Because there's so much of diseases that are cropping up because of lifestyle issues and healthcare issues and across geographies. So we need to be on top of things. You know, some of the Ebola virus that came in, people like going from one location to other location. How do we prevent such kind of things to happen so that your business is not getting impacted, right? So all of those stuff requires talent development, right? And also look at two-speed IT. So what we call this two-speed IT is bi-modal IT, right? At one time, you need to still focus on traditional methods to follow because there is governance, legal and regulatory compliance like HIPAA that you need to fulfill. But in the other one, it could also be how to do digitally. So some of the aspects you can move to Agile, DevOps, social, mobile, and other stuff to do that. So it's a kind of combination of this that will get you kick-started in your transformation journey. So remember the mission, understand to get ground control, and then start boosting. And it could be in any kind of sector within healthcare, right? It could be what are you focusing, and then use this as an appropriate way to do this. And this is sources from McKinsey's healthcare technology practice. So I'll give you an example of how we did a case study of how we went about doing this in an agile practice. So what we did in a healthcare unit was we wanted to adopt agile practices. So what it meant was, you see a lot of people come new, doctors, physicians. So we wanted to pair up as a team and try to demonstrate clinical skills, right? So we wanted to focus on clinical skills and see whether they are able to do it repeatedly. As I said, sometimes the way one of the physician does a clinical expertise might be different from someone else. So what is important is how could you make it repeatable? And that's where we looked at a kind of a sprint approach, where we looked at some of the product backlog, which is like clinical skills. So what we did was we looked at normally what we measure from a patient, like heart rate, respiratory rate, blood pressure, body temperature. So we gave a parameter. So what used to happen was if someone was new, they used to measure these parameters, look at what is the skill, and used to report to the doctor. So the doctor used to immediately give a feedback and say, is this right, is this wrong, where it needs to be improved. So they took a specific item that needs to be showing compliance, showing expertise of what we need to do, and they produced the results. So what was happening is the demo gave a lot of clinical, they demo the clinical skills to at least one doctor. The doctors then provide immediate feedback, and then you use improvement using sprints. So what they do is they look at one section and then they start building those user stories. That means how is this particular feature or functionality going to use for a patient? And then they start demonstrating on it. And once they make an improvement, they go to the next item in the product backlog. It's like slowly trying to move from a traditional one to a digital transformation mode, right? So those were kind of tested, and it was very useful because they got instant feedback and they were able to replicate agile methods to all other sectors. One is the admin department, then the insurance department, then the lab department, then the support staff. So they took a section and they started adopting agile practices. Now, what does an agile practice look like in context is they have like a kind of a Scrum. We call it a Scrum, which is a Scrum, which is a popular agile practice. So what they do is they have a product backlog, so for the list of items that you need to do as part of healthcare, some of the things which are important. And from there, they build a sprint backlog. So a sprint is basically 2 to 4 weeks time, where we say, okay, these are the aspects which are priority for us, and we will actually implement that to show some value for it. So what they do is they have a 15 minutes meeting daily with the people. So it could have a nurse, it could have a physician, it could have a doctor who will come there and say, where are we in this particular junction? Do that and see whether we are able to release that particular product or service which is going to be giving value. So at the end of the day, the whole exercise of Agile is to deliver incremental value for your consumer, your patient. So as and when you do this, you start making this much more repeatable, and it is much more aligned with your strategy of digital transformation. So this is kind of Scrum, that's a framework or a methodology that we use to adopt Agile, and it could be applied in any industry. And we have done this as part of our healthcare part of it, and how they have seen repeatable performance in terms of clinical demos, right? And these are some of the meetings that they have and other stuff. So essentially, these are elements that will help people to deliver value. So I'm not going to get into the crux of it, but generally, if you see, there are aspects of what are the list of priorities that your patient has come back, and which is the top priority that you're going to address as part of the first sprint. And let's say you want to achieve these aspects within that sprint, how much we achieved and how much we did not achieve. That's part of planned versus actual. And then how do we deliver value out of it? So there's a lot of repeated meetings. And how do you work as a cross-functional team, like the admin team, the support team, the physicians, the nurses? How do they work together to make the end-to-end experience of the consumer omnipresent, right? That's a key aspect of digital transformation that we are talking across, right? So that's something that we can apply into that part. Then we have DevOps. Now, when we have DevOps, how to work together as a team to make things work with automation, right? One is Agile is focusing on delivering products and services faster, while DevOps is making sure that it's also stable enough, right? Because you can release a new drug today, but it also has to test with time. So you bring in the kind of stability part of it so that you don't have an issue. For example, I give this example of a Samsung Galaxy S7 phone. Now, you remember that S7 Galaxy has got an issue. That was a fire that broke because of the battery and other stuff. Now you have a great product or service that you go to the market, but because it's not stable enough, you're losing your reputation. So people are losing across. So in your DevOps environment, you need to have a culture and environment where all your products and services that you do with healthcare is doing well, repeatedly, frequently, and more reliability. So nobody has a bitter experience when they come and talk with you as part of digital transformation, so that the patient is able to get his ailment done properly diagnosed, he gets his reports on time, and do that. So you build automation as well as part of it. In a nutshell, applying DevOps in healthcare requires comms. We need to have a culture change. People have to move faster in the way we need to adopt to the new way of working. We need to emphasize on automation, because automation is going to prevent this negligence and human negligence and errors that we talk about. And we have a lot of wastages that you see in your own value stream mapping, right? How many times we ask the same question again and again to the customer. He asks so many records to be filled in, and people just lose interest. So a lot of waste that happens. So we need to adopt Lean. Lean is a methodology for applying, improving the flow, delivering value by removing and reducing waste. And we need to measure the right parameters in terms of how much time does it take for a customer to come in, enroll himself in a healthcare unit, and then move on, right? And how do you share that information? There's a huge amount of knowledge that exists today within the healthcare industry. But how do we share that knowledge? How to share that expertise of one physician and nurse to the entire system cross-functionally so that they're able to leverage the best practice of it. So that's how DevOps is applying into the healthcare. Automation, lean culture, automation, lean, measurement, and sharing. Now, there's a lot of value that Agile and DevOps together can have it, because many companies think that there has to be two-step process. One team which focus on traditional infrastructure, movement, and other stuff. There's another way where we are trying to do moving it faster, digitally transform, looking at the omni-channel experience. So we call it as bi-model IT. So one is a traditional way, and the other one is adopting Agile and DevOps. This is very critical if you need to be in a digital transformation. So if you're a health sector company, a hospital, agent, we need to understand if you don't move Agile and DevOps practices, you're not going to be in thick and thin of the digital transformation journey. Now, having said that, it cannot be done without your enterprise architecture, right? Now, you need to understand your overall architecture. You look at your information systems, solutions, your business architecture, your technology architecture, but then also importantly, specifically align your digital architecture. Now, this digital architecture will not be able to do justice if you don't have an enterprise architecture. So I know a lot of our doctors here also have enterprise architecture expertise, Dr. Alvin Marshall, Dr. Fazilia, and many of the people who are really experts. They have TOGAF elements that actually brings in a lot more value, because when you're talking about a digital transformation, if you don't have a strong digital architecture, have a holistic way of looking at an enterprise architecture, you're not going to do that, because you're going to have issues in terms of security, right? We are going to have an issues in terms of technology, because the new technology is happening across. You need to have this data governance. So a lot of information, solutions, business, all will have to provide context on how you drive your enterprise architecture one. And how does it expand in your digital architecture is, how do you respond? How do you do identity access management? We talked about, how do you identify a patient record? Different government ID proofs and other stuff. How do you respond to different interactions? What are the kind of experience people interact with digital media and so on and so forth? So enterprise architecture is going to be a backbone for your digital transformation. And this is the last slide that I had, was if we need to manage the business of healthcare, we need to have a kind of architecture which is like IT for IT, which is a strategic way to assess your current state and future state of IT capabilities. Because as a healthcare unit, we need to decide on, what's your enterprise architecture doing? How are we going from strategy to portfolio? How are you going from requirements to deploy? The requirements could be as easy as a customer wanting some experience to the time that you provision that particular thing, right? So how is the build, test, and packaging capabilities doing? And request to fulfill is like a shopping experience where we can go like Amazon, where we can just click on something and you get that experience. So similarly, if someone is going to subscribe to your healthcare services, how can you request a service and then it gets fulfilled using telemedicine or other channels to get what he needs? And then if there are issues, like for example, patient ailment was not done well, how to correct it, so detect to correct. So these are value streams that are actually focused on assessing your current state and future state of IT capabilities, but also bring in an operational way for IT management standards and best practices to deliver the digital transformation, right? With that, I'll come to my final slide of how do we do that. So you need to understand what is value, what is the delivery engine that you're doing across in terms of Agile, DevOps, what is the kind of infrastructure, could be Internet of Things, cloud, security, and your capabilities in terms of governance, talent, and stuff. So you need to have these 4 dimensions of value, delivery, the foundation layer, and capabilities to make it a digital transformation. So my final summary for the digital transformation, as you might see in health sector, require understanding of your key business drivers and value propositions. What are your customers wanting to do? What are the challenges that is being faced today by your consumer that you need to address to make their experience a fulfilling one? So you need to have a strong enterprise architecture, which we talked about, which is spawning into a digital architecture. You need to embrace Agile and DevOps practice. How do you move things faster? How do you make it automated? How do you do culture, automation, lean, measurement, sharing? And also leverage the power of SMAC, because you're talking about social, you're talking about mobile, analytics, cloud, and also run the business of managing healthcare. That's a meta way of how to deliver using value streams. And that is how some of the aspects of digital transformation could be achieved. It's a long journey. You need to understand where you are in your journey of digital transformation, take some cues of where we need to do it, and then take it forward on that. With that, I will open it up to Cha and the rest of the team for a Q&A. I'll be more than happy. I think we have another 10 minutes time, 9 minutes time. I'll be more than happy to take the questions. Any other questions?
Thank you, Dr. Suresh. We have a question here from Dr. Suresh Kumar. It reads, could you throw some light on available focused digital transformation talent development for healthcare professionals?
Yeah, so that's a great question, Suresh. So one of the things that we are talking about for healthcare professionals, and we are constantly working with AeHIN and the rest of the Ministry of Health Care across thing, is to come up with curriculums that are meaningfully addressing how healthcare industry is evolving. So one of the things that could be useful from a talent or skill development perspective is to focus on the current challenges in healthcare, and then take that as a use case scenario and develop content and courses as to how that challenges can be addressed through digital transformation. So you're not trying to give you a monster, but then small consumable items or modules that you can consume and say, hey, in this particular challenge, how does digital transformation is going to happen? And what kind of process we need to follow, what kind of practices we need to follow, what kind of automation we need to follow. So it's a kind of doing it in capsule form. So you slowly try to chew the elephant and then get insights to it and then start slowly progressing. So it's a kind of an iterative process if you want to develop talent, skill development. Enablement is an important aspect. Domain expertise of people who are using this practice to leverage value is important. So in fact, we bring in practitioners and talk to them as how these practices are going to help across. In fact, as we speak, we are going to have a meeting with healthcare professionals on 29 and 30 in Singapore to look at how governance elements is getting addressed through for healthcare, right? So the only way, Suresh, is to bring in practitioners who have the domain expertise, bring in expertise of people who are doing this digital transformation, and collaborate with them and form a module or a course, an enablement, which makes people understand these in a very pragmatic fashion and able to take it to their workplace. Hope that answers your question. Any other questions, Cha and people?
So we have a question from Dr. Fazila. It reads, as much we say measurable targets, much of it is still qualitative. Is there a catalog of quantitative targets as reference in digital transformation?
That's a great question, Dr. Fazila. I think there are still, so again, the qualitative and quantitative part is a very important aspect of accuracy and value proposition. Now, as you think, the digital transformation still relies on experts like you. So whatever you think is important parameters to measure, that becomes something that we can do it. So while digital transformation is only going to be as meaningful as the human expertise, we will have to leverage your expertise in terms of what you think is measurable targets being valuable based on the healthcare data itself. So what we have seen in terms of digital transformation is we look at across sectors. Across sectors, we see how the meaningful reporting happens in terms of parameters. For example, the time where the healthcare, the guy enrolled till the time he comes out, how much time does it take to diagnose and do that, some of these parameters, including drug and efficiency in which response happens. So some of these parameters are picked up from the historic data as to what organizations feel is meaningful. But at the end of the day, it's all about your expert information that qualifies that could become digital transformation. So it's digital transformation cannot, by itself make sense without experts and human intervention of the health experts. Any other questions?
There are no questions so far, Dr. Suresh. For those with questions, please type your questions in the questions box. While we're waiting, I would also like to take this opportunity to invite everyone to attend our upcoming webinar next week on OpenHIE. The focus will be on the interoperability layer, so that will be at 3 p.m. Manila time. We'll be waiting for your questions now. Thank you.
And we help, one of the things as we get questions is to, if we have further questions, please send us a note. We'd be more than happy to see what areas within the digital transformation that you would want more insights to it. And we'll be more than happy to do it as upcoming webinars for AeHIN through CCNC Solution. We've been associated with AeHIN for quite a long time, doing the TOGAF courses for all your practitioners, healthcare. We are also launching the IT for IT, the Archimate courses, and some of the people who have attended it. So we'll be more than happy to provide those insights as well, if there are some of the interest. So you can actually feel free to let us know through AeHIN if there are any specific areas that you want to cover in terms of knowledge sharing sessions, and we can attempt to do that in the upcoming sessions.
Dr. Suresh, I think there are no more questions.
Yeah, okay. So thanks everybody for your time, and thanks so much for taking the time in the wee hours of the night and attending it. I hope you got some takeaways from there. I'll share it with the AeHIN team, so they will be able to share the PDF for you, and it's also going to be recorded. So if someone has already registered and haven't had time to attend it, don't worry. Please feel free to pass it on to other colleagues and industry partners who would be benefiting from that. And we look forward to hearing from you for other sessions. As Cha mentioned, please attend the AeHIN webinars. They have so much of value for everybody. And I thank so much AeHIN for this opportunity for us and CCNC Solution to present to that. Thank you, everyone.
Thank you, Dr. Suresh. Thank you, everyone.